Hello everyone, this is the video for chapter 11. So let's go ahead and get started. If you'll go ahead and load your PowerPoint, my notes for chapter 11. The first two slides I went ahead and left on there. Generally in a face-to-face class I'll do some review of a previous chapter, some ideas. This one here is related to deaf and also visual impairments. So anyway, we'll go ahead and get on to chapter 11. There will also be a slide in here that will have your assignments for the week. So make sure and look at that. Make sure that you're prepared. This is a big week for you. So let's go ahead and get started on chapter 11 on attention deficit hyperactivity disorder along with health impairments and physical disabilities. Some of the objectives that you should have an idea about once we get done with the chapter are, first of all, you'll be able to define attention deficit hyperactivity disorder, ADHD, and describe the most common treatment options for ADHD. You'll be able to define physical disabilities and health impairments, and you should be able to state two reasons why the number of children served under other health impairments or orthopedic impairments categories of the IDEA is much smaller than the actual number of children who have health impairments or physical disabilities. You'll also be able to list and describe the types and causes of health conditions and physical impairments seen most frequently in school-age children. You'll be able to briefly explain how severity, age of onset, and visibility of a health impairment or physical disability can affect a child's educational performance, and also discuss the importance of a parallel curriculum for students with health impairments or physical disabilities. And finally, to explain why the continuum of educational services and placement options is especially critical for students with health impairments or physical disabilities. So one of the first things what you do is get a piece of paper and pencil and answer this question: how might the effects of an acute health condition on a student's classroom participation and education progress differ from those of a chronic condition? So basically the difference between the effects of an acute health condition on a student's classroom participation compared to those of a chronic condition. So go ahead and pause and go ahead and write down your ideas, and then come back and we'll discuss how close you came. All right. Most physical disabilities and health impairments that result in a child receiving special education services are chronic conditions, meaning they are long-lasting and permanent. Like cerebral palsy, which there will be a video later on that will help go into a little bit more information about cerebral palsy. Acute conditions may be severe and debilitating, however, they are typically short-term, like pneumonia. A child who has an acute condition may have limited participation in educational progress, but it's only temporary. Where, for example, a child who falls behind due to acute illness may need remediation to help him catch up, whereas a child with chronic condition is likely to require long-term services of appropriately intensive supports. ADHD definition and diagnosis. The essential feature is a persistent pattern of inattention and or hyperactivity or impulsivity that is more frequent and severe than is typically observed. And there are three ADHD subtypes that the book talks about. There's combined, predominantly inattention, and predominantly hyperactive or impulsive. You must exhibit 6 or more symptoms for at least 6 months or in 2 or more environments. 55% have the combined type, whereas 27% have the predominantly inattentive type, and 18% have the hyperactivity impulsive subtype. Just some information. Eligibility for special education and prevalence. Children with ADHD can be served under the other health impairments category under Section 504. APA estimates the prevalence of ADHD at 5% of school-age children. Boys are 3 times more likely to be diagnosed with ADHD than girls. The ratio is higher at younger ages, and a large proportion of the 779,000 children who received special education services in 2012 to 2013 under the OHI category were diagnosed with ADHD. So it gives you a little bit of a background, and remember, if it's in red, you'll probably see it on a test or a quiz coming up. The academic achievement and comorbidity. Most children with ADHD struggle in the classroom. They score lower on tests of academic achievement tests, they earn lower grades in school, and have a more difficulty with skills that support academic achievement. There is comorbidity with other disabilities like EBD, ID, LD, autism, tic disorder, or obsessive compulsive disorder. They may be classified in those areas instead of any other health impaired. The causes of ADHD are not well understood. There's no clear and consistent evidence that links brain damage, dysfunction to behavioral symptoms of ADHD. The evidence indicates that genetic factors may place individuals at a greater than normal risk of an ADHD diagnosis. And research using neuroimaging technologies has shown that some individuals with ADHD have structural or biochemical differences in their brain. So those are just some of the causes. Let's look at the treatment. Medication. Prescription stimulant medication is the most common intervention. There's no clear evidence that indicates that stimulant medications lead to improved academic achievement. Behaviorally based intervention is also used. There's applied behavior analysis, which you'll go into later on, and teaching self-regulation and self-monitoring skills. Now what I want to say here, this is one area where I like to mention and talk about medication a little bit. I've heard many teachers that complain when they have a student with similar features like ADHD, and they complain when they hear they don't take medication, and they're still having trouble in the classroom. Why put their child through this? And really getting on to the parents for not letting it happen. Well, I myself know firsthand about this, and there are many different factors that go into play when parents are looking at the possible medications that their doctors are suggesting. There are many side effects that may come with the medications that are prescribed for students that have ADHD, and there's a time that passes for parents and doctors to get the correct combination if they do continue looking at medication for ADHD. And so these side effects may actually, to the parents and to the family, may actually be more detrimental to the student and their behaviors than having them on the medication. Many times you get students, as they get older, they don't feel like themselves, and they don't want to be on the medication. And sometimes too, as they get older, as they gain weight, as things change, their medications may not work as well as what they did in the past. So don't immediately be on the parents if the student is not medicated. Talk to the parents about things. Remember, you are the educational person that is the professional, not the medication. You're not the one that's going to be the one that says they ought to take medication. There's many factors that go into play, and you really need to look into that. There's lots of articles about it, so I'm not going to get into it anymore. But if you do have questions, look it up. There's plenty of research out there to give you some ideas of why it's not just an easy one medication to fix anything. And generally speaking, it doesn't fix things. All right, let's go into definitions of physical disabilities. There's severe orthopedic impairment, or OI, and it's things like congenital abnormality, like club foot or absence of a limb. Might be impairments caused by disease, poliomyelitis, bone tuberculosis, impairments from other causes like cerebral palsy, fractures, burns, or other items. Also adversely affects educational performance. As you recall, you should have known that by now, that you would see that in this. Then there's definitions of other health impairments. There's limited strength, vitality, or alertness due to chronic or acute health problems. These can be such as asthma, attention deficit hyperactivity disorder, diabetes, epilepsy, a heart condition, hemophilia, leukemia, sickle cell anemia, lead poisoning, nephritis, rheumatic fever, or Tourette's syndrome. And it must adversely affect academic performance. There are many students in your classroom that you may see in their medical history that they have some of these, but that doesn't mean they're on an IEP. I know I had epilepsy as a child. I haven't had any in quite some time, so I'm off of medication and doing fine. But I was not on an IEP for my epilepsy. It did not adversely affect my academic performance. ADHD could be the same way. Even though they have that, they may have medication that is making them do fine, and so they don't need any support on an IEP. And asthma may be the same way. It may not be as bad as and so it may not affect the academic performance of that child. So just because they have some of these impairments or some of these medical diagnoses, do not just assume. All right, let's go on here. Orthopedic impairment involves the skeletal system, where neuromotor impairment involves the central nervous system. Chronic conditions, remember, long-lasting and most often permanent, whereas acute conditions, they're limited duration. So just a repeat on those too. Here's another question for you. Why is the prevalence of chronic medical conditions in children much higher than the number of students receiving special education under the disability categories in the Individual with Disabilities Act of orthopedic impairments and other health impairments? That's a lot of words in there. So pause the video and give your idea as to why you think the prevalence is much higher than the number of students receiving services. Well, let's see how you did. Two factors make the actual number of children with physical disabilities and health services under these categories. First, in order to qualify for special ed services, a child's physical or health impairment must adversely affect his or her educational performance. And as I discussed earlier, many children have chronic conditions that do not adversely affect their academic educational performance, so they do not receive special ed services. Additionally, many children with chronic physical or health impairments have multiple disabilities, and they are receiving special ed services under another disability category. Let's talk about the prevalence then. During 2012-2013 school year, around 59,000 children between the ages of 3 and 21 years received services under the orthopedic impairment disability category, or about 779,000 were served under other health impaired. These two disabilities represent approximately 1% and 12% of all children receiving special education, respectively. The actual number of children served is much higher than the number receiving special ed services because many children who with OHI and OI receive services under other categories, and some do not require special education services, which you should see as a repeat, but I want you to remember that one because when you get to be a regular ed teacher, you will start having these questions, and hopefully you will remember that. Here's another question for you. Why do you think attention deficit hyperactivity disorder, ADHD, is not included as a separate disability category? Well, in order to be diagnosed with ADHD, a physician must determine that a child has consistently displayed 6 or more symptoms of either inattention or hyperactivity impulsivity for at least 6 months with an onset before age 7. Because the federal government has stipulated that students with ADHD are eligible under OHI category, it is probably unnecessary to create a separate category. Additionally, a substantial number of students diagnosed with ADHD receive special ed services under another category, like their learning disabilities. So let's talk about some of the other categories that fall under other health impaired. You have epilepsy, is when seizures occur chronically and repeatedly. Seizures are caused by abnormal electrical discharge in the brain. Types of seizures are generalized, tonic-clonic, absence, complex partial, and simple partial. Aura is a warning sensation that takes various forms and appears a short time before a seizure. And seizures can be controlled with medicine in 70% of cases. Then there's diabetes, a chronic disorder of the metabolism that occurs when the body is unable to obtain and retain adequate energy from food. There's type 1 diabetes that have insufficient insulin. There's type 2. The most common form results from insulin resistance, hypoglycemia, and hyperglycemia. You might want to read a little bit more about those to know the difference. Chronic lung disease resulting in a narrowing of airways. Most common lung disease of children prevalence range from 7% to 10% of school-age children. The leading cause of absenteeism in school. Causes are unknown but considered an interaction of heredity and environment. And then there's emotional stress can be a causative factor. Treatment involves an asthma teaching program. Then you have autosomal recessive disorders. They're inherited when 2 copies of an abnormal gene are present. Most common types are cystic fibrosis, sickle cell disease, and Tay-Sachs disease. So you might want to read up on a little bit of the differences there. Then there's HIV and AIDS. HIV can lead to AIDS. A person with AIDS cannot resist and fight off infections because of a breakdown in the immune system. At the time of the book, there's no vaccines or cures. Advances in antiretroviral drug treatment reduce mortality rates. Parents are not required to inform the school their child has HIV, but school personnel should be trained in universal precautions. We've got another one now, another question, so if you will, pull out your paper again. How might the visibility of a physical disability or health impairment affect a child's self-perception, social development, and level of independence across different environments? So if you'll go ahead and take a look at that and see what your thoughts are, go ahead and pause the video and go ahead and write down your answer and then come back. Okay. Well, let's look at the answer and see how close you came. Well, how children think about themselves and the degree to which others accept them are often affected by the visibility of their condition. Some children use a variety of orthopedic appliances that make their physical impairments more noticeable and make the child with disabilities look even more different from their classmates without disabilities. The visibility of some disabilities may cause others to underestimate the conditions that are not as visible, like asthma. It may decrease the inclination of others to provide the student with needed special education services. So just remember that and try to make sure that you have ways in your classroom, in your organization, that helps those students feel accepted into their classroom, no matter how many times they may go out of the classroom due to working with special education. Cerebral palsy is the next one. A disorder of movement and posture, a permanent condition that results from lesion to the brain or an abnormal brain growth. It's the most prevalent physical disability in school-age children. There's no clear relationship between the degree of motor impairment and the degree of intellectual impairment, if any. And classified according to muscle tone, there's hypertonia and motor movement. And it's classified as spastic, athetosis, and ataxia. And next one I have is actually a video out of London. Again, it's the most prevalent physical disability among school-age children. I want you to listen to this video, give you some ideas and some a little more information because you will probably have a student at some point that will have cerebral palsy. So click the link, please, and go ahead and see what you can learn. All right, have a few more. Hopefully you gained what I wanted to get out of that, a little bit more information. What I want you to do here is look at the next one, is spina bifida. It's a congenital malformation of the brain, spinal cord, or vertebrae. It's the most common neural tube effect, can result in paralysis below affected vertebra. There are 3 types. There's spina bifida occulta, the mildest form. There's many, and I'm sorry you're going to hear me try to get over these words, meningocele and myclomeningocele, most common and most severe form. So anyway, look at them, you'll understand. Then there's hydrocephalic condition, common in many children, with the most severe form, treated with a shunt, requires clean intermittent catheterization. Some of the types and causes: muscular dystrophy, progressive atrophy of the body's muscles. There's Duchenne muscular dystrophy is the most common. Spinal cord injuries caused by penetrating injury, fracture, stretching, or compression of the spinal cord. It can result in paralysis. The higher the injury on the spine and the more the injury cuts the spinal cord, which may lead to quadriplegia or paraplegia. Some of the characteristics: with physical disabilities or health impairments, they function well below grade level academically. Daily health care routines and medications may have negative side effects. Educational progress is often hampered by frequent and sometimes prolonged absences. As a group, these students perform below average on measures of social behavioral skills. Concerns about physical appearance and reasons for emotional difficulties and feelings of depression are also discussed. Variables affecting educational performance. A physical disability or health impairment can limit a child's ability to engage in age-appropriate activities, mobility, cognitive functioning, social and emotional development, and sensory functioning, and communication across the continuum ranging from normal functioning to extremely impaired. The age of onset. Children with congenital or acquired impairments have different needs. And visibility. The visibility of the impairment may cause some to underestimate the child's abilities and limit opportunities. So just because they're in a wheelchair, just because they walk with a limp, just because they're using a walker, do not underestimate their ability. See where they're at and challenge them just like you would any other student. This is where I think we really need to concentrate on. There's many students that I've seen that, according to paper, their abilities should be better than what they are. But I do believe that in the past, teachers underestimate and don't challenge them as much as what they would just because of their disability. Teaming and related services. There's a lot of people that are going to be involved with students that are in this category. You may have physical therapists, you may have occupational therapists, you may have speech and language therapists, speech and language pathologists, adaptive physical educators, recreational therapists, nurses, there may be a prosthetics, orthotists, orientation and mobility specialists, biomedical engineers, health aides, counselors, and medical social workers. So you may have a larger team that needs to be involved with these students. So make sure that you know who they need to be involved with. And the next slide just gives you a little bit of a difference because we do have occupational therapists and physical therapists that are heavily involved in our students. So make sure you look at that slide. OTs are concerned with a child's participation in activities that promote self-help, employment, and communication, whereas PTs are involved in the development and maintenance of motor skills, development, and posture of students with physical disabilities. There's different educational approaches the book discusses. There's environmental modifications like barrier-free architecture, functional adaptations. There's assistive technology. There's low-tech and high-tech. So make sure and look at those. There's assistive technology devices and assistive technology services. There's also animal assistants. There's helper as service dogs. There's also monkeys as personal care attendants. If you haven't looked at that, do a search for monkeys as personal care attendants. I think you'll find it interesting. Special health care routines. Proper positioning and movement encourage the development of muscles and bones and help maintain healthy skin. Proper seating helps combat poor circulation, muscle tightness, and pressure sores, and contributes to proper digestion, respiration, and physical development. And then lifting and transferring requires making contact with the child, communicating what is going to happen in a manner the child can understand, preparing the child physically for the transfer and requiring the child to participate in the routine as much as possible. And this is one that you'll definitely want to have some assistance. A lot of times the school nurse can help with training staff on the lifting and transferring of students in their wheelchair or to a walker, to a wheelchair, all of those, because you'll want to know how to work with students. Then there's independence and self-esteem. Children need encouragement to develop a positive, realistic view of themselves and their physical conditions, as much independence as possible, the ability to cope with their disabilities, set realistic expectations, and accept help gracefully when needed. The ability to explain their physical disability or health condition and to respond to questions, and collaboration with self-help groups for people with similar disabilities. The next one I want you to look at is a video on ADHD, because students with ADHD, they can look and act like the typical student many times during the day, and then the times they're not. They also discuss in the book about emotional behavioral problems that may occur. You definitely need to look at this. And I want you to look at the video here, a father refusing to accept ADD learning disability label. I think it's a great perspective from a parent. So please, take your time. I know there are probably some videos that you all don't watch, but this one here, please do. Please get on there and watch the video now and then come back to the rest of the slides. Well, I hope that helped you get a better perspective and an outlook of a family's perspective of a student with ADHD. Now I want to look at placement options. During the 2012-2013 school year, 55% of students who received special education services under orthopedic impairment and 60% of those with OHI were educated in general classrooms. So that means you're going to see a preponderance of a student with ADHD or orthopedic impairments in your classroom, and you will have to modify or adjust your classroom and your strategies. 22% and 16% respectively were served in resource rooms, whereas 10% of those with OHI and 22% of those with orthopedic impairments were educated in a separate classroom. They can be technology-dependent students that you need to watch for and help. Lastly, I got 2 or 3 more slides, but this one here is the last question I want you to answer. Of the many ways that the physical environment, social environment, and instruction can be modified to support the inclusion of students with physical impairments, health impairments, and ADHD, which are the most important? Go ahead and pause this video and take a look at writing down what your thoughts are. What are the most important? Well, let's see how you did. Teachers of children with physical and health impairments often find it necessary to adapt equipment, schedules, or settings so that their students can participate more fully in educational and recreational activities. Although there is currently an increasing trend toward integrating children with physical and health conditions, this practice has raised several controversial issues. These issues revolve around determining the extent to which teachers and schools should realistically be expected to care for students with physical and health-related disabilities. Decisions concerning the safety of all students must be made. Perhaps the most important classroom modification is creating an atmosphere in which the student with disabilities feels socially accepted and comfortable enough to learn and contribute. And again, we discussed it early on, with their more visible disabilities at times comes the difficulty of making sure the student feels socially acceptable and that the students in the class understand and also accept them as part of the classroom. And lastly, related services in the classroom and inclusive attitudes. These controversial issues concern including students with physical impairments and special health care needs in general ed classrooms. The extent teachers and schools are responsible for a child's physical health care needs. Just refer to Irving Independent School District versus Tatro, where catheterization is a related service. And then Cedar Rapids Community School District versus Garrett F. Nursing services are related services. So these are now items that either you or a paraprofessional or a nurse may be required to do to help the student be in your into the general classroom. So definitely take a look at these different court cases in your book to get a better understanding of the items that you will be required to do as a regular ed or special education teacher. But again, acceptance is the most basic need of children with physical disabilities and healthcare impairments. Again, look at your slide as far as what are your assignments. With this one here, you have a couple big ones coming up, so make sure that you take a look at that and make time to get those completed. The discussion board is also on there as far as that, so go ahead and make sure and get ready for that also. I would suggest you get that started early. You can start that on Tuesday and then get on Thursday or Friday, and then also Saturday to Sunday to finish that up, and take a look at your peers' postings, and then get your work done. Anyway, have a great week, and I will see you again next week.